All of us from time to time get down, sad, blue, hopeless maybe, and it usually has something to do with our life situation. That's just normal human sadness, and sadness has a way of coming and going, and it sometimes is more serious than others. But sadness is not the same as major depressive disorder. So major depressive disorder involves depression which comes on, which lasts a longer period of time, at least several weeks, often several months or even longer. It has at least 5 of these 9 symptoms I'm going to tell you about. Now you don't need all 9. You need only 5, but you need one of the first 2 symptoms. The first one is depressed mood, being sad, blue, down in the dumps, hopeless, helpless, most of the day, nearly every day for at least 2 weeks. Or you have to have markedly decreased interest, pleasure, and enthusiasm out of life events that you should enjoy or used to enjoy. So you have to have either depressed mood or decreased interest and pleasure in life events. One of those 2 first D's. And then you need at least 4 of the following symptoms. Trouble with sleep. Not getting restful sleep, no matter how much sleep. Some people sleep too little, some people sleep too much. Having a change in appetite that's unusual for you. Mostly it's probably when people are depressed, mostly it's decreased appetite, but for some, they just nibble and graze. Decreased ability to think, concentrate, remember, pay attention, and focus. Negative thoughts such as guilt and worthlessness that are out of proportion to the situation. Feeling guilty for things that you did or didn't do in your life. Feeling worthless for really no reason. Decreased energy. Feeling sluggish and slowed down or agitated and fidgety. And finally, feeling that life is just not worth living. Having suicidal thoughts. So, if you have one of the first 2 symptoms, depressed mood, decreased ability to enjoy or get pleasure out of things, and at least 4 of the rest of the symptoms, sleep, appetite, concentration, guilt and worthlessness, decreased energy, feeling tired and fatigued when you haven't done very much at all, or feeling suicidal. If you have at least 5 of those symptoms, including 1 or both of those first 2 symptoms, for 2 or more weeks of moderate or more severity, so it's not just a minor annoyance, and that cause either severe emotional distress or impairment in your life functioning, we call that major depressive disorder.